While explaining type 1 hypersensitivity, I had come up to primary mediators and secondary mediators, which are nothing but pharmacological mediators released by activated mast cells. And these mediators create havoc in the body because they circulate in the blood and distribute to different parts of the body and act on smooth muscles, blood vessels, and cause constriction of blood vessels, constriction of smooth muscles, vasodilation at regions where it is unnecessary. The blood vessels will dilate because of the prostaglandins being related in excessive amount. Blood clotting may also affect because of platelet activating factor. And bradykinins released as the secondary mediators increase vascular permeability and smooth muscle contraction. Now, the adverse effect of these pharmacological mediators, what one would experience in type 1 hypersensitivity, we will see it in detail. It can be classified into two types of reactions: generalized systemic anaphylaxis and localized anaphylaxis. Generalized or systemic anaphylaxis is more severe and detrimental compared to localized anaphylaxis. The generalized systemic anaphylaxis involves the entire body, that includes even the internal organs. The person not only will find the effect on the skin as appearance of rashes or excessive sweating, or he may feel uncomfortable due to internal organ dysfunctions. In other words, he may have respiratory discomfort, may find difficulty in respiration, or he may have excessive respiration. There is a possibility of palpitation and increased heartbeat. Sometimes due to excessive pharmacological mediators, it may result in cardiac arrest. It may also act on the gastrointestinal tract, where the excessive contraction of the gastrointestinal tract may be experienced by the person, leading to discomfort, excessive gastric cramp, sometimes even excessive blood pressure in the brain area, resulting in hemorrhage in the capillaries of the blood-brain barrier, that may result even in the paralytic stroke in the person. So the systemic anaphylaxis, which spreads all throughout the body, may affect majority of the organs. If not controlled, may lead to death of the individual. In order to demonstrate what happens with the effect of pharmacological mediators, in vitro experiment can be conducted, which is called as Schultz-Dale reaction. SCHULTZ, Schultz-Dale, DALE reaction, where a small intestinal piece of a mice is obtained, which is washed with saline and suspended in human physiological saline, and to that intestinal piece, which is somewhere about 2-inch long, the serum of the person who is suffering from type 1 hypersensitivity is added. As soon as the serum is added to that medium where the intestine is lying, the intestine will contract immediately from 2-inch to 1/2 inch. This is the intensity of the reaction of contraction of the smooth muscles, because intestine is lined by the smooth muscles, which is experienced in vivo in the person if a person is subjected to the effect of pharmacological mediators. This is how one can demonstrate in vitro the contraction of the smooth muscles. So this Schultz-Dale reaction tells the intensity with which the contraction can take place by the action of the pharmacological mediators. Therefore, one should take care to prevent the generalized or systemic anaphylactic reaction from taking place in a person by keeping medicines at hand if the person is known to suffer from hypersensitivity of type 1 with certain allergens. So the treatment of type 1 hypersensitivity, I will discuss it little later. As far as localized anaphylaxis is concerned, it is hypersensitivity reaction experienced at a region of the body which is localized, which is not spread all over the body but localized. It is in some area. So it could be the skin of an individual and it is localized only to the skin, then it is called as cutaneous anaphylaxis. It may be in the form of dermatitis or eczema, or it could be experienced by the person, the anaphylactic reaction in the bronchial region, that is especially with respect to the bronchi or trachea, the respiratory region of the lung, and constriction, extreme constriction of the trachea may take place or bronchi may take place because of the pharmacological mediators, and that is called as bronchial anaphylaxis, which is with the bronchial area. Or it could be gastrointestinal tract, confined to gastrointestinal region, where the person may experience severe contraction of the gastrointestinal tract, or it may result in reverse peristalsis resulting in vomiting or excessive defecation. So the localized reaction is confined to certain areas which may be sometimes target oriented, in the sense if the skin has come in contact with the allergen in the form of a synthetic cloth, or it could be wool, or the epidermal hairs of insects, caterpillar, or it could be of the plant origin, and the itchiness on the skin may be experienced locally. Sometimes it is called as target oriented. Sometimes the person may experience severe itching on the skin or urticaria like symptom on the skin, where wheal and flare reaction can be experienced. Even though it is localized, it is non-target oriented because he may have consumed some food which he is allergic to. The seafood, or probably the egg, or probably the milk proteins, or groundnuts, or walnuts. He may be allergic to the proteins of these nuts, and after consumption of these allergens, he might have experienced the cutaneous anaphylaxis, that is, experience of extreme itching on the skin, and the skin will show wheal and flare reaction and elevation, which would be in the form of welts, which is called as non-target oriented. Similarly, non-target oriented asthma can happen in a person when he consumes food also. By consuming a particular type of food for which he is allergic, he may experience asthma. That is called as non-target oriented localized anaphylaxis. But on coming in contact with allergens directly, that is by inhaling the perfumes or fragrance of the flower, or could be the industrial pollutants, the smell of industrial pollutants, the person may experience bronchial anaphylaxis. If that happens by direct contact, then it is called as target oriented. But on consumption of food, if a person suffers from asthma due to allergy, then it is called as non-target oriented, the localized anaphylaxis. So as far as the two different types of anaphylaxis are concerned, both these anaphylaxis, that is Generalized as well as localized anaphylaxis could be controlled by using certain special drugs. There is also another type of anaphylaxis that is called as passive transfer anaphylaxis, which is dangerous in the sense unknowingly it can happen during the blood transfusion reaction. In the sense, the person who is generally allergic should take precaution while donating blood for the blood transfusion. If the person has recently suffered from any allergic reaction, he would have active pharmaceutical mediators in his blood circulating still, and in such a condition, if he donates the blood would contain the pharmacological mediators, and on transfusion of such blood to the other person may experience discomfort because of the action of the pharmacological mediators. And this is called as passive transfer anaphylaxis. It sometimes happens and it can be demonstrated by a, a test called as Prosnitz-Kutzner reaction. The Prosnitz-Kutzner reaction is nothing but the two scientists, Prosnitz and Kutzner, of, among whom one of them was sensitive for fish. On consumption of fish, she would develop red rashes, patches on the skin as shown in the diagram. So the person who developed the sensitivity against the fish antigens, whose serum was taken and was injected into intravenous route to the other person who was not allergic to the fish antigens. And after 48 hours of time interval, the person was given the extract of the fish antigen as intradermal injection as shown in this diagram. On giving intradermal injection, the area where the injection was done will develop a red patch. The red patch indicates the person has got transferred the allergic pharmacological mediators of the other person into him through the serum, and he is showing the sensitivity to the antigen in the dermal area because it was locally injected. Imagine if the person consumes the fish when he is sensitized, he may also develop the red patches on the skin who was not sensitive to the fish earlier. So this is called as passive transfer anaphylaxis. So this may happen in individuals unknowingly if the blood is transfused from an allergic individual who readily has the pharmacological mediators in his blood in active nature. So therefore, one should take precaution while transfusing the blood, and especially in the case of the people who need excessive blood during the transplantation of organs or bypass surgery. In such a condition, the person is already going through a trauma of surgery, and if the allergic person's blood is transfused into such people, it will lead to severe complications. Therefore, one need to be very careful and should not volunteer to transfuse or to give the blood for the transfusion. Then coming to the different types of allergies. The allergies can be classified into two types: atopic, that is hereditary, and non-atopic, that is non-hereditary. Hereditary allergies are hereditary through the family history, means it runs in the family of an individual. For example, some families have history of asthma, and that asthma runs in the family in one or the other individual. Similarly, some families have the history of dermatitis, and some families have the history of eczema. These are hereditary allergies and one need to be very careful as far as hereditary allergies are concerned, atopic allergies are concerned. So non-atopic allergies are those which are acquired by the individual during his lifetime. It can happen by a coincidence. The person who is perfectly normal will suddenly start developing allergic reaction against certain substances on coming in contact with those substances, or inhalation of those substances, or coming in contact on the skin surface, or after consumption of a particular type of food, he may start developing allergy for which there was no previous history in the family, and such acquired allergies are non-atopic or non-hereditary allergies. Allergies are classified as follows. One of them is hay fever. The name comes, which is called as hay fever, because it is caused by the hay or the grass in the farmers, and it is also called as allergic rhinitis. The grass family or the hay family, all the grasses or food grain grasses contain epidermal hair, and these epidermal hair, whether it is paddy or jowar or wheat, any of the grass family, the epidermal hair which is present on the stem and the leaves of these plants, when the plant is thrashed for extraction of the grains from the plant after the harvesting, the epidermal hairs will fly in the air. The thin epidermal hairs, which are very light, which fly in the air, are inhaled by the person who is handling the hair, as well as these hairs may come in contact with the person in the mucosa of the eye lining. Eyelids, eye lining, the mucosa will be also in contact with the epidermal hairs. On continuous contact with these epidermal hairs which are flying in the air during the occupation by the farmer, these hairs will embed themselves in the mucous lining of the nostrils and the mucous lining of the eyes, causing irritation to the eye as well as to the nostrils, and the person would have continuous sneezing, oozing of the nasal fluid, and as the time passes by, he may start suffering from mild fever. And this experience felt by the farmers is called as hay fever. And on avoiding these epidermal hairs by covering the nostrils with the mask, as well as covering the eyes with the goggles, proper goggles which cover the eye properly, one can avoid the reaction caused by the epidermal hairs of these plants. The hay fever is generally experienced as an occupational hazard by the farmers while handling the paddy or wheat or jowar plants while thrashing them after harvesting. The other allergic reaction is asthma, the bronchial asthma or bronchial allergy. It is two types, intrinsic or extrinsic. Intrinsic asthma, in other words, is caused due to internal factors, that is, the release of pharmacological mediators inside the body because of the contact with allergen, and that allergen, the person might have come in contact with it through the food or through the skin, and the intrinsic factors such as those pharmacological mediators will cause constriction of the bronchial passage, resulting in asthma. The extrinsic factors are nothing but all the external agents which are allergens, like fragrance of the flower, fragrance of the deodorants, even the environmental pollutant like plastic odor, that is burning of plastic, or it could be even the industrial smoke, the pollen grains of the plants during the flowering season, or the causes as extrinsic factors. On inhalation of these substances by the person, it could result in bronchial asthma. And bronchial asthma is a very severe disease which causes the respiratory discomfort. If the person doesn't take first aid measure by using steroid spray into the nostrils or into the bronchial passage, may find it difficult and he may choke to death if it is severe. The other type of allergy is gastrointestinal allergy, which comes through the food. Several types of foods which I had listed earlier in the first lecture of the hypersensitivity, which could be in the form of different types of proteins of animal origin or plant origin, or majorly sometimes become allergic to some individuals. Recall back, it could be even the milk protein or the fish proteins, shellfish proteins, or it could be egg proteins or proteins of nuts, which could result in gastrointestinal discomfort. On consumption, the person will feel extreme constriction in the gastrointestinal area, reverse peristalsis possibly, sometimes resulting in vomiting, or it could cause severe pain in the gastric region. So coming to the urticaria. Urticaria is a skin allergy and it can be experienced by any individual who is exposed to an allergen, and it results in the form of wheal and flare reaction. Here you can see on the back of a person the swellings have taken place, reddening of the area, and it is a welts formation, and it could happen when a person has wore a synthetic cloth or a woolen cloth, or by application of some lotions on the skin surface, or it could be due to consumption of allergic food. And this urticaria will appear all over the body in a person, resulting in itching and wheal and flare reaction, which is highly discomforting for the person. And as far as the angioedema is concerned, it is restricted only to the anterior part of the body, that is to the face, neck, and probably to the chest. Here you can see the swollen lips of a child, and it is due to the allergic reaction experienced by the child, either maybe after consumption of the food to which the person is allergic, or due to administration of some drug for a particular disease. The person might have developed the sensitivity and the angioedema is shown in the lips. The second possibility is angioedema can be experienced by a person when antivenom is administered, or if penicillin toxicity takes place. Penicillin is a drug, life-saving drug. If the drug is not tested for the sensitivity, if it is administered, the person may experience this type of reaction where you can see the swollen eyelids, swollen lips, face is swollen due to angioedema. And it is restricted only to the anterior region of the body. As far as the dermatitis is concerned, it is restricted to the skin, and you would see the rashes will appear on the skin as red blisters. Once again, it may be due to consumption of food for which the person is allergic, or wearing of the cloth to which the person is sensitive. It could be synthetic clothes, synthetic fabrics, woolen cloth may result in dermatitis in the person. The rash which appears will be spread over the skin as long as the person is in contact with the allergen, which can be only controlled by the medication, and the rash will be highly itchy on the skin surface. Now coming to the eczema, the infantile eczema and adult eczema is there. Infantile eczema will appear in the children. It appears at a very early age due to contact with allergens, and it may appear on the face, or the eczema may appear on the back of the neck or back of the body, armpits, the groin, the front of the knee or back of the knee, or it could be even the ankle region. These are the areas where eczema will appear. Eczema is slightly different from dermatitis in the sense it will after some time start oozing a colorless fluid, the plasma, from its surface, and which may result in secondary infection by the fungus because the plasma contains a lot of protein. So eczema appears as a rash, simple rash like dermatitis rash on the skin surface initially, but it will become festered due to oozing at the later stage. Here is the eczema shown on the back of a person, infantile eczema, and you can see here the eczema appearing on the knees, back of the knees, and the person who suffers from eczema, either it is because of the allergic reaction towards the food that he consumes, or allergic reaction towards the contacts that he establishes with the environmental factors like various kinds of plant materials, or it could be environmental pollutants. As far as the treatment of hypersensitivity, type 1 hypersensitivity is concerned, majorly antihistaminic drugs are administered. The antihistaminic drugs block the H1 and H2 receptors on the target cells and prevent the action of histamine on the target cells, thereby relieving the person from the severity of the reaction. Similarly, another drug called as cromolyn sodium blocks the calcium entry into the mast cells so that they fail to undergo degranulation. If they undergo degranulation, then only they can release the pharmacological mediators. By preventing them from degranulation, one can decrease the severity of the reaction, that is by administering cromolyn sodium. Epinephrine is adrenaline which stimulates the cyclic AMP production by binding to beta adrenergic receptors, and by binding to beta adrenergic receptors on the mast cells, it prevents the degranulation of the mast cells. Once again, that will decrease the severity of the reaction. Cortisone, that is the corticosteroids, reduces the histamine level by blocking the conversion of histidine to histamine. Histidine is stored in the mast cells in the form of granules in the granules of the mast cells, and the conversion of histidine to histamine is prevented by the blocking by the cortisone. Thereby the histamine release is prevented. This is how one can control the type 1 hypersensitivity, and one can keep these drugs, the person suffering from type 1 hypersensitivity, under the supervision of doctor, can keep these drugs and prevent the severity of the reaction like systemic anaphylaxis or localized anaphylaxis. Now this is a localized plant which is called as Plectranthus ambonicus, and it is locally called as sambarballi, and the juice of this plant is used for the relief for urticaria. By applying the juice on the skin of the person suffering from urticaria or dermatitis, and even to some extent eczema, the person will find it relieving by the presence of this juice on the skin, and it has got some kind of antidote activity. Now coming to the next type of hypersensitivity, that is type 2 hypersensitivity, which is called as antibody mediated cytotoxic hypersensitivity. Here, majorly the antibodies involved are IgG and IgM. And it is against the particulate antigens or the antigens that are attached to the membrane. The reaction is by the antibody on the antigens that are attached to the membrane. The first type of type 2 hypersensitivity reaction is with reference to blood transfusion reaction. The blood transfusion reaction will take place due to mismatch of the blood groups, that is AB blood group. If the blood group is not matched and transfused into a person, the antibodies against the blood group being IgM will be triggered in the person into whom the opposite blood group is being transferred. And the IgM is an innate antibody, as well as it will be produced immediately in large quantities, and it results in destruction of not only the transfused blood, the blood of the person, the host also. The reason being, IgM is a pentameric antibody against the blood group antigens, AB blood group antigens, against which antibody that is produced is IgM, which is pentameric, which can immediately trigger the complement mediated lysis. The complement mediated lysis triggered by the IgM on complexing with the antigen would result in lysis of the RBCs. Therefore, one need to take care while transfusing the blood group has to be matched perfectly. It should be A blood group A plus, that is A Rh positive, A Rh positive, B Rh positive, B Rh positive. I will come to the Rh antigen little later. The concept of universal donor, universal recipient, all that is not going to work. I have already mentioned that earlier also in the innate immune response, because only 1 unit of blood of the O blood group can be transfused, because O blood group is considered to be universal donor into any other blood group. But remember that O blood group person does have antibodies against A and B blood group. Large quantities of O blood group transferred into any other blood group, A and B blood group, would result in lysis of the RBCs of the recipient, because the IgM antibodies of the O blood group person would destroy those antigens which are present in the recipient and results in complement mediated lysis, and immediately the urine will start becoming red because of the hemolysis of the RBCs. So the blood transfusion reaction is because of the mismatch of the blood groups, which should not happen. As per the WHO rule, only the blood group of the same blood group with proper matching should be transfused in the person. Coming to the tissue graft rejection reaction. Here we are talking about the antigens on the tissues, which are MHC antigens, major histocompatibility antigens. Generally on the tissues, the major histocompatibility antigens will be of class 1 type, and class 1 antigens of different tissues differ in the same individuals. An individual would have 6 different antigens on his tissues. If it is not matched when the transplantation of the organ is done, then the person who receives the graft or the tissue would mount an immune reaction against the antigens that are present on the foreign tissue that has been transplanted into the person. And This reaction is going to be so severe, and the antibodies that are produced against these mismatched antigens of the tissue will be IgG type. And these IgG antibodies will start binding to the grafted tissue and initiate complement mediated lysis of the grafted tissue if the person doesn't take care by using immunosuppressive drugs. Generally, one can match a tissue up to 85%, but it is not possible to match the tissue to 100% except among the identical twins. Even among brother sisters or between parents and child, the tissue matching can be achieved only up to 80-85% and not more than that. In such a condition, there will be always a mismatch in the antigens of the donor's tissue and the recipient tissue because of the class 1 antigens being different. So, therefore, the recipient immune system always mounts an immune response against the grafted organ by producing the antibodies against the mismatched antigens. Therefore, immunosuppressive drugs are administered to control the rejection reaction. However, if the immunosuppressive drugs are not used, what happens? The IgG antibodies produced against the mismatched antigens by the host will react on the tissue graft and bind to the tissue antigens. On binding, the IgG antibodies will initiate complement mediated lysis of the graft. At the same time, as I had mentioned earlier, there are cells, immune cells, which have Fc gamma receptor on their surface, like neutrophils, macrophages, eosinophils, and the NK cells. Now, all these cells which are provided with Fc gamma receptor, that is for the IgG, can come and bind to the IgG through the Fc receptor, and when the IgG is bound to the antigens of the graft, these cells will bind to the IgG through the Fc receptor. On binding to these antibodies, these cells can initiate cytotoxic reaction, which is called as ADCC, which I have already explained, that is antibody dependent cell mediated cytotoxicity. Antibody dependent cell mediated cytotoxicity, resulting in lysis of the graft. Thereby, two different reactions, that is IgG mediated complement mediated lysis and immune cells mediated ADCC reaction on the graft, tissue graft, by the host will result in destruction of the tissue graft. Thereby, the graft will fail and the graft will be completely destroyed. So this is as far as the cytotoxic reaction, which is type 2 hypersensitivity, is concerned. Now coming to the Rh antibody mediated reaction, that is erythroblastosis fetalis, which happens in the child which is Rh positive, which is developing in a mother who is Rh negative, and the Rh antigens are found on the RBCs of the developing child, and the Rh antibody will be produced by the Rh negative mother. The first pregnancy may go through safely without any problem. Depending on the severity or amount of the antibody produced by the mother, it may go through safely. But the second pregnancy by the mother, where the Rh positive which will be developing in her womb will experience the severe reaction by the Rh antibody. The first sensitization of the mother results in Rh antibody production, which will be in memory in her bone marrow. And as soon as the second child, Rh positive child, starts developing in her womb, she will start producing the antibodies immediately, and those IgG antibodies against the Rh antigens will diffuse through the placenta and will start attacking the RBCs of the child. Because of the attack of the RBCs of the child will find the deficiency of oxygen, and the child will be born as blue baby when delivered due to deficiency of the RBCs, which will fail to carry the sufficient amount of oxygen due to binding of the RBCs by the Rh antibody. So therefore, one need to take care in the mother who is Rh negative and who carries Rh positive child, for which a monoclonal antibody has been developed, which is called as ROGAM, and this ROGAM antibody is against the Rh antibody. This monoclonal antibody, that is ROGAM, when given intravenously to the mother, it will circulate in the blood and reach the nooks and corners of her body, and wherever Rh antibody is present, and even the Rh antibody, if it is reaching the fetus through the placenta, the ROGAM will reach there and bind to the Rh antibody and prevents its action on the fetus. So therefore, one can prevent erythroblastosis fetalis in the fetus. So therefore, one need to take care of this cytotoxic reaction of the type 2, which happens with the Rh incompatibility in the fetus. When Rh positive child is developing in a mother, as a precaution, it would be advisable to administer the monoclonal antibodies at 3 months interval, that is at the 3rd month, at the 6th month, and at the 8th month of the pregnancy. By intravenous route, the ROGAM administration is carried out so as to prevent erythroblastosis fetalis, a cytotoxic reaction that takes place in the fetus due to Rh antibody. Then, as far as another last example of the type 2 hypersensitivity is concerned, that is drug-induced hemolytic anemia. The drug-induced hemolytic anemia would occur in an individual due to hapten interaction. As I had mentioned earlier when I had explained about the haptens, some of the drugs would act as partial antigens, and sometimes they may bind to the proteins of the RBC membrane, and probably even the drug metabolites as haptens may bind to the proteins of the RBC membrane. On binding to the proteins of the RBC membrane, they behave as antigens and initiate the antibody production. And the antibody produced against the hapten protein complex would react on that hapten protein complex, resulting in lysis of the RBCs. And this lysis of the RBC would cause hemolytic anemia, because RBCs will be lysed and lost by the person, and hemolysis of the RBC would result in anemia, deficiency of RBC. At the same time, the antibodies produced against the hapten protein complex may initiate ADCC response by activating the immune cells to come and bind to the antibody which is already bound to the hapten protein complex, resulting in lysis of the RBCs. So this is a strange reaction, sometimes experienced by the individuals due to certain drugs which sensitize them, and these drugs may act as haptens and cause hyper 2 sensitivity in them by leading to destruction of their RBC, because these drug molecules may form complex with their RBC membrane as haptens and resulting in antibody production and resulting in type 2 cytotoxic reaction against the RBC. Now, coming to other examples of the type 2 hypersensitivity, which will be discussed even in autoimmune response, where the antibodies, autoantibodies that are produced against the self antigens, say for example, the autoantibodies produced against the beta cells will result in destruction of the beta cells, which is a kind of type 2 hypersensitivity. And the autoantibodies produced against the TSH receptor, thyroid stimulating hormone receptor, also may result in destruction of the thyroid follicles, which is called as Graves' disease. Similarly, autoantibodies produced against the thyroid follicles, which is called Hashimoto's thyroiditis, will result in destruction of thyroid follicles, as well as the autoantibodies produced against the ACH receptor, which is distributed all over the body on skeletal muscles, may result in myasthenia gravis. This also can be given as type 2 hypersensitivity reaction as well as an autoimmune reaction. And in all these cases, there is destruction of the cells, which is cytotoxic destruction. We'll stop here.